Hepatitis C, we have great medicines now, and we've actually had them for close to 2 years now, really had effective therapy that's has the potential to work extremely well for almost every patient. The main issue over the last 2 years or so has been our ability to actually get those medications to patients who need them. So there's a number of things that come into play when you're talking about barriers to getting patients with HCV treated. One of the biggest ones in the United States is still just diagnosing them. So we have estimates that maybe half to up to 75% of patients who have hepatitis C are not yet diagnosed or do not yet know they have infection. And even those that know they have hepatitis C or have been told previously they have hepatitis C, many of them are not seeking actual care for their hepatitis C, not going to a doctor to try to get treated. There are a number of reasons for that, but one of the big reasons is a lot of patients who are at increased risk or who have hepatitis C are in populations that are more marginalized. They're either from lower socioeconomic classes, they have ongoing substance abuse, drug use, or psychiatric illness, and all those things contribute again to making it hard for patients to actually get in to see their doctors. So in that Meet the Professor session, Stacy Truskin from Philadelphia was also there, and Cami Graham was moderating, and all of us have had kind of similar experiences with trying to start programs to improve testing for hepatitis C, and then once patients are tested, improving ways that they can actually get linked to care, which means they actually go and see a physician who can help them, hopefully, with their hepatitis C. There's still lots of things to do. I think we all have found that trying to set up programs in clinics that take care of these difficult populations, so federally qualified health centers tend to take care of a lot of patients at lower socioeconomic classes or have other problems, and so trying to start screening programs in those places is one way to try to help improve access and limit barriers. But there are still lots of logistical issues along the way. Funding, there aren't a lot of programs for patients with Hep C alone. I also take care of patients with HIV, and particularly co-infection, so they have both HCV and HIV. And in that scenario, we have the benefit of HIV has great support services and a lot of programs that patients can avail themselves of if they have HIV, and that spills over then into a co-infected patient where we can use a lot of the HIV resources and services to also help them with their Hep C. Patients who have Hep C monoinfection, there are not a lot of programs. There's not a ton of advocacy for those patients. There are some groups, but it's not been traditionally as vocal as a population with HIV. So that's another challenge for HCV monoinfected patients in particular. If you have somebody that has HIV and hepatitis C, right, their HIV medicines don't do anything for their hepatitis C. But the programs that are available to fund patients with HIV, so say ADAP, drug assistance programs, most of them actually do cover hepatitis C medicines as well. I don't know if I would call it double dipping per se, but they're available, and the reason is it's recognized that hepatitis C is an extremely important co-infection in patients with HIV. Their hepatitis C tends to be a little more aggressive in that it progresses a little faster, and certainly once they get advanced liver disease, we know patients with HIV, if they do develop complications from their liver disease, they're much more likely to die in a short time frame than somebody that has, say, HCV alone who also has end-stage liver disease. So because of the profound effect hepatitis C has on mortality in people with HIV, all these assistance programs have been very willing to encompass HCV treatment as part of a comprehensive program to treat patients with HIV effectively. And they cover medications if the patient's insurance or other means aren't able to step in and cover the HCV medication.